I'm going to give you a hand towel. You're going to drape it over your genitals and just furniture out of the way, rest it up on your belly, move it to the side. Doesn't matter, right?
All right.
So just because I don't really need to see what your testicles look like.
What's up, guys? We're back. It's the Best Midland Texas podcast where we interview and have in-depth conversations with local business owners, entrepreneurs, and personalities. I'm your host, Ryan Shewchuk. This is my lovely wife and co-host, but wife first.
Thank you.
Terra Avery. Do us a favor. Listen, if this is your first time watching or you've watched a couple episodes, subscribe. Help us out. Let's beat this crazy YouTube algorithm. Let's become famous together. Today, we've got a very special episode. It's our first doctor.
It is. Today we have Dr. Amanda Moe. She is helping us to solve all the pee, poop, pregnancy, postpartum, penis pain, and pelvic floor problems.
Whoa. A lot of peas. So we say Dr. Moe. Can we call you Amanda?
You can call me Amanda.
Okay.
Yeah.
So you're a doctor specifically for pelvic floor
therapy. Yep.
pelvic physical therapy, but pelvic floor therapy, right?
Yeah. So it's a doctor of physical therapy, and then you kind of get your little specialty branches in whatever niche you're in. And so mine is pelvic related rehabilitation. So pelvic floor, pelvic girdle, that type of stuff.
What made you want to specialize in pelvic health? I don't know how to say that.
Yeah, that was good. So during grad school, they give you all of the basic information, orthopedic, neuro type of physical therapy training, and then your last few semesters or year, they kind of introduce the specialty niches, I would say.
Okay.
My last year, we had a gender health teacher that did pelvic physical therapy, and she just had these wild stories that, that kind of made you be like, okay, what? You're doing that? I remember one sticks like in my head. It's really silly, but so it's this older lady. She's probably in her 50s, pretty conservative, and she's talking about how she was doing pelvic physical therapy for a man who had prostate cancer and surgery. She was supposed to go in, evaluate him, kind of talk him through some tips to improve his rehab, right? He was in the hospital. So she was newer. She went in and she was like, oh, okay, hi, my name is Jane Doe or whatever, and I'm here, I'm your pelvic physical therapist. I'm going to teach you about this, this, and this. And her assessment was to kind of see his pelvic functioning, which your pelvis surrounds your holes pretty much. So
surround your holes.
Surrounds your holes,
okay.
right?
All right. That makes a lot more sense.
Your pee hole, your poop hole,
Got it.
your vagina hole, right?
All of it.
Yeah, all of it. So she had explained that, and then was looking to assess this man who just had surgery. She said, yeah, just make sure when you do assess someone, keep a straight face because you never know what you're going to see. And so I'm like, oh, okay, what? She said that she was looking at his pelvic floor functioning or trying to assess it, and he was kind of draping, but his testicle kind of fell down, and it was the size of a melon.
Whoa.
So I was like, so that always stuck in my head as something like, what?
I want to see that.
Oh, yeah. Yes.
Okay.
But I mean, it's common for that type of surgery because sometimes they take out some lymphatic tissue around the area, but it does typically go down. But I mean, the size of a melon, she couldn't even see what she was looking for.
Are we talking like a cantaloupe or like a watermelon?
I'm talking not a watermelon, but like a large cantaloupe.
Okay.
Yeah.
She used to talk about like patient rehab and their appreciation for pelvic therapy. There's a lot more appreciation when you're helping someone fix their erectile dysfunction or no pain with intercourse versus a 16-year-old who sprained their ankle and like don't care. You know what I mean?
Yeah.
So yeah, I think that's what kind of just her weird stories and then rotations and stuff.
Okay.
So.
Yeah. I like that, the weirdness.
Oh,
Because I would be the same way. Like
whoa, no one told us.
There's no way that I could. There's no way I could keep a straight face. So they'd be like, "You're fired immediately."
Oh, you have to get really good at it, and you would be shocked when it comes to who comes through your door and what people say. That you really have to just
poker face,
not be like. I'm talking older men and women engaging in certain activities that you're like, okay, you just kind of move on,
like,
and then you leave the room and you're like, oh. Okay.
Okay.
That's
So you have
what's
to-
up.
It's
right?
basically like you have to be like, I've heard this a million times. Like
Yes.
it's,
Like it's
like
just, it's not shocking. It's
second
not.
nature.
Yes,
Yeah.
absolutely.
And I mean, I know when I have to talk to my doctor about things, I'm sitting there going like, dude, I know you've heard this a million times, but like me looking you in the eye and telling you what I'm about to tell you is weird. You know
Yeah.
what I'm saying?
And
Yeah.
I'm like, just talk to your doctor.
So let's start there. What is a pelvic floor?
Okay, so your pelvic floor is at the bottom of your pelvis. So if you put your hands on your hips,
Yep,
right?
yep.
So the bones kind of in between are your pelvis.
Okay.
So there's front bones, back bones, side bones.
Okay.
So there's a little hammock or a sling that goes from front to back, side to side.
Okay.
That's your pelvic floor. So it surrounds your holes, like I said before.
yeah.
So in men, that's your anus, and then your taint or your perineum. That's your
Okay.
pelvic floor,
Okay,
right?
all
Everybody
right.
knows that, right?
Yep.
Right?
Yep. Yep. Okay.
Or I don't know. I've heard a lot of terms over the years, but I usually stick with I'll say perineum, and if people look at me and they're like, "What are you talking about?" Your taint.
Right.
Oh,
Yeah.
okay, I get it.
You got to go medical first,
Right, and then I back
textbook,
it
and then you're like, well, we know.
Yes,
Okay. It's a
yes.
taint.
Didn't we have this conversation the other day? I swear it was you and me, because I don't know who else I would be talking about.
Yeah, I can't wait
Taints
to hear
with.
this. I can't wait to hear this.
But on a woman, the area between is also a perineum, right?
Yes. So
Okay.
it's the same medically in men and women. So from your front to your back and your sides, everything in between is your pelvic floor. For men and women, it surrounds your hole. So men don't have a vagina, so that muscle is just
Hot
fused.
take.
Hot take.
Got it.
That muscle is just fused together.
Okay.
So the same muscle that surrounds the opening of the vagina is it's the same in a man, but it's just like this instead of open. That muscle that's like this goes up mid shaft of your penis. Okay. So
Okay. All right.
that's your pelvic floor.
I don't know why I had to look up and envision it, but I got okay.
That's
yeah.
okay.
I'm right.
He's like, hold on, I have to go to the mirror real
okay.
Got
quick.
it. All right. Got it.
Yeah. So as pelvic floor physical therapists, we're concerned primarily with that region, but we also kind of zoom out a little bit because it's influenced by other things. So your abdomen and your belly muscles attach into your pelvic floor, your groin go into the sides, your bum over the back. You can have pelvic floor dysfunction, and we can talk about, what that is or what it could be. That's influenced by your abdomen or your groin or your back or your bum.
Okay.
So it's kind of its own little subsect of physical therapy that specializes in that region.
We had this debate earlier this morning, which was it Kegel or Kegel? And what did you say
So
earlier?
it's regional. It's really
She said
regional.
Kegel. I was like,
It can
Terra.
be. So I could do a whole little thing about like the names that I've heard throughout the years.
Please do.
Kugel is one. Love that.
Oh,
So
Kugel.
little old lady. Do I need to do Kugels?
So how would one know, either male or female, if pelvic floor therapy is something that would benefit them?
So there's 5 main functions of your pelvic floor. One is with sphincteric control, so controlling your pee and your poop. Sorry, I said poop.
Gross. No, I get it. Okay.
Controlling your pee and poop, supporting your organs. So this one's a little bit more relevant in women. If you've ever heard of a prolapse, that's when you have an organ that is a little bit more droopier in your pelvis. So your pelvic floor helps support those organs. Stability. So it's a part of your core. So it's the kind of missing piece that everyone forgets about. It's the bottom. So your core is your belly, your back, and your diaphragm muscle at the top and your pelvic floor at the bottom, right?
Gotcha.
So it's part of your core. Sexual functioning. So these,
Very important.
Yes.
Very
hello.
important.
The muscles of your pelvic floor become engorged with arousal. With orgasm, they're contracting rhythmically. So if you have muscle weakness or tension, that can affect your sexual functioning. And then sump pump. So it's more lymphatic, dispersing lymphatic. So like the guy who had the big melon testicles, that was a
melon.
lymphatic problem, right? Among maybe some other things. So when you think about why someone would come to pelvic floor physical therapy, really dysfunction in your pelvic floor or pelvic girdle has to do with those type of symptoms. So if you think about sexual functioning, so in a woman, if you have tension in your pelvic floor muscles, so they're not as mobile or as soft as they should be, remember they surround your opening. So You can have pain with intercourse. You can have difficulty with intercourse. You can have trouble peeing because it surrounds your pee tube. You can have difficulty pooping. Okay. And then for a man, if you're thinking sexual functioning, so the front part of your pelvic floor is responsible for getting and maintaining an erection.
Okay.
So if those front pelvic floor, if those front pelvic floor muscles are too tense or too tight, a lot of times they contribute to erectile dysfunction, either difficulty getting or maintaining an erection, or strength of orgasm, things of that nature. So any type of sexual dysfunction. Sometimes you'll see men with pain with arousal or pain with ejaculation. That's for sure typically a pelvic floor contributor.
Okay.
And then when you think about sphincteric control of your pelvic floor or holding in your pee and poop, so any pee and poo problems, so constipation, fecal leakage, gas leakage, man or woman.
Yeah.
This isn't just like a weird night out. You're talking like this is like this has been going on for a second. You're like,
Well, so, I mean, you can have people who've had dysfunction that kind of creeps up and then, the scale is kind of tipped and then they have, symptoms that are bothersome. And
got it.
a lot of times we see people who have had a long-standing history of childhood urinary or bowel dysfunction, and they just thought that was normal.
Okay,
You know what I
right.
mean?
Just like life,
So
yeah.
it just depends on what's impactful or what really bothers you. It affects sexual functioning, pee and poo problems. So basically anything. If you're peeing too frequently, so you're peeing normal is every 2 to 4 hours.
I was gonna. I was immediately
There
gonna
you
ask
go.
how many
Yeah,
times.
I have a
is normal?
girlfriend who goes like every 20 minutes.
Yeah. So
And it's like-
okay,
and it's
so
urgent.
So she needs pelvic.
Okay, I'm
floor
going to
PT.
tell her. She's in LA, so let me know if you got anyone out in LA.
I can give me your zip code and I'll find someone
Perfect.
for her. But yeah, so something like that, that is outside that 2 to 4 hour range.
Okay.
Yeah.
That can be associated with certain types of pelvic floor dysfunction. Usually it's going to be more tension based. So if you have a tighter, less mobile pelvic floor, you're going to get certain types of symptoms. So frequent peeing, strong urge to pee, leakage. You can also have weakness in leakage. And that's where it goes to not everybody gets Kegels, because if you gave your friend who's peeing every 20 minutes Kegel and maybe has a tight pelvic floor, or peeing every 20 minutes and gave her Kegels, it would probably make her worse versus someone who's lax and needs actual strengthening. So any type of urinary dysfunction, people who think they have a UTI and they go get tested and it's never a UTI, a lot of the times that's tension or not emptying your bladder all the way because of pelvic floor dysfunction. And then pain. So for men, this is where it gets fun because this is my favorite thing to talk about.
Yeah, this sounds fun.
Because everybody knows, or they're at least more aware of women with pain.
That's what I was gonna.
Especially
say,
after child, I don't have children, so I feel like it in my mind as like a consumer or whatever, it makes more sense why women would need it more, but men obviously need it too.
Right.
I didn't know I had a pelvic floor until
Everybody,
yesterday.
Yeah, if you have a pelvis, that's what I say. Well, if you have a pelvis, you have a pelvic floor. If you're peeing and pooping, you have a pelvic floor, right? But yeah, it started off being more popular and relevant to women because they go through childbirth and your pelvic floor becomes stretched, and then you can have some dysfunction after birth or while you're pregnant. So that's definitely the most popular sect of pelvic PT. So my favorite is kind of the male side for men who may need pelvic floor physical therapy. Most people assume, it's a bunch of old dudes with leakage or,
Right.
farting all over the place or whatever. Can't poop.
Yeah.
And I would say there's kind of two main categories of men that we see.
Okay.
And yes, older men we do see. It's more your prostate cancer, enlarged prostate, and some dysfunction because of that. But what really isn't talked about and really well known is younger-ish men. So I would say anywhere from 20s to maybe early 40s. Most of the men that we see in that age range are going to be pain type of symptoms and urinary symptoms or bowel. So it's going to be tip of the penis pain, testicle pain, taint pain or perineum pain,
Sounds terrible.
erectile dysfunction, premature ejaculation, pain with any type of arousal or ejaculation, stuff like that. I would say it tends to lean towards more tension-based dysfunction. Have you ever seen someone who's like type A? You know what I mean? And you're like,
Oh, right, yeah.
just, whoa, I need to take a breath after like being around her. Right. So typically someone who is type A tends to have more muscle tension, right?
Okay.
So and they call it type A or anal retentive, right? So anal retentive, so
Yes.
tight pelvic floor.
They know what they
okay?
were doing.
Right. So men can be that way too, but it's almost sneaky sometimes how they present. Like you don't have to be outwardly anxious or type A, but you can have tension and then that'll lead to or contribute to some of those symptoms. So like the sexual dysfunction, the pain symptoms, the frequent peeing, dribbling after urination and stuff like that. So that's probably the least talked about little area of pelvic PT is like younger-ish men. A lot of the times we'll get referrals for men and they're like, you want me to come for what? And like,
Right.
are you going to stare at my
junk?
what? Yeah. If it's bothersome to you and it's really affecting
Sure.
your like relationship or your functioning at work, you better believe people are going to come. And it's going to be weird. At least they'll think it's weird and then it's not when it's there. You know what I mean?
'Cause I feel like men are probably maybe more uncomfortable by it because, like, as women, like we have pelvic exams.
Right.
You know, it used to be yearly, and now it's like spread out a little bit more. But like, we've been putting our stuff in people's faces,
Right.
for medical purposes,
Okay. All right.
for a long time.
Let me put a disclaimer.
So like we're,
Right.
I mean, it's not my favorite thing to do, but you know,
Yeah.
Where are you located in Midland?
So I practice over at COM Aquatics. They actually have a physical therapy department. There's talks about doing a couple of like pop-up educational courses or therapy services in other locations. So that's kind of
Very
like
cool.
to be determined.
Sure.
And
Yeah.
then, virtual consults. Like I get some virtual consults from old places I worked at, Pennsylvania, Houston. People are like, how do you treat the pelvic floor virtually? And you can, but you have to know what you're doing, and it has to be with the right person, I guess. So they have to be willing to like, all right, I'm going to give you these things.
Right.
You're going to try it. You're going to do it.
They probably have to have a really good camera, like an iPhone 14 Pro Max or something. You know what I mean?
Right.
On
For the
Zoom.
most part, we try not to, we'll educate you like, hey, here's your anatomy, this.
Right.
Like, shut your camera off. Go try it.
Yeah,
see
yeah.
what you think. Hit
CIA
me
is
back.
watching, so
Right.
turn that webcam off. You never know.
Well, right.
Okay, so what should one expect when they go to their first therapy session with you?
Yeah, so I'm going to kind of break it up into like men, women, or kids because it'll be different based on that. What do you want me to start with?
Ladies
Men.
first.
Ladies first.
Ladies
All right,
first.
let's do it. Okay, typically we'll give you a pretty in-depth questionnaire or medical history form. We're asking all about your pee problems, your poop problems, or just your pee habits, poop habits, your births if you've had it, or pregnancies, any type of sexual functioning, like do you have pain with intercourse? If so, when? Is it position dependent? Is it this? Is it that? Just because that makes the eval very efficient because I can read it and say, okay, we have pain with deep penetration. We have this, right?
Start to filter it, yeah.
Right. So I can like hone in on the assessment and expedite your rehab. Then what we'll do is we'll do just a functional movement screen, and that's to kind of zoom out and see if something else is contributing to your pelvic floor. So zoomed in. So we'll have you stand on one leg, we'll have you squat, we'll have you bend down, we'll have you lay down, we'll check your range of motion and strength in your hips and your pelvic girdle. We'll take a look at your abdomen, we're looking at your breathing. And then we're actually fortunate enough to have an ultrasound machine. So it's just like a sonogram like you would get for if you're pregnant.
Yeah.
It's specifically for physical therapy. So usually we use it as a screening tool to look at your pelvic floor, but it's on your abdomen. So it's like you don't have to be naked, and then we'll start the pelvic floor assessment. So usually I'll preface it like, hey, okay, today we're going to assess your pelvic floor if you're able to, or if you're okay with that. It's different than an OB-GYN exam. You're You're not in stirrups. We don't use a speculum. It gives us an idea of how to treat you and figure out what's actually causing your dysfunction or your complaints, right? So I'll talk them through that. And basically what it is it's an external, we step out. You undress kind of from the waist below.
Okay.
Cover yourself up with a sheet so you're not just like butt naked there.
I was going to ask, what do you wear? Like, do you know?
Yeah, just waist below. Cover yourself up with the sheet. And then I say, okay, we'll come in. We'll take a look. We'll have you squeeze. We'll have you let go. We'll have you lengthen. And I'm just looking to see, like, is it moving the right direction? Are we coordinated or are we not?
Okay.
You can tell sometimes, too, based on, again, your history, like, oh, they're probably going to be tense, right, because of X, Y, and Z. Then you'll take a look, and if their perineum or their lady pain or whatever is elevated or drawn in, you're going to know, like, oh, okay, yep, I'm thinking tension, I'm thinking, this, or whatever. Or if they're on the flip side where they're a little bit lax or loose, and then you ask them again, like, squeeze, relax, lengthen, and you're observing what happens when you do that.
What does lengthen mean? Like,
So
You got me.
right, nice. So your all muscles contract, relax, and stretch, right? So stretch, right? So your pelvic floor squeezes to hold your pee and poop in,
Okay.
functions at rest, okay, and then lengthens. So it relaxes when you pee.
Okay.
It lengthens when you poop or when you have a baby.
oh, so you're like kind of doing a pushing.
Right. So
Gotcha.
I'll say push, or I'll just say push like you're going to pass gas, or like,
Okay.
push out. And it's not like it's a big movement, but I'm just seeing if you have coordination of
Right.
it or if it's going in the right direction.
Gotcha.
Then we palpate or touch externally just to see how it feels. Again, you're going to know if someone has tension because they'll either have pain or it'll be real rigid when you touch. So think about like when you're squeezing your bicep, contracting it, and you're to touch it.
Yeah.
Like, oh, it's pretty firm, doesn't have a lot of give. Versus like an arm at rest, right?
Yeah.
It's
Okay.
going to be softer. So we'll usually tell them like, hey, I'm going to road map this for you. If you're laying on your back, like up by your clitoris is 12, your anus is 6, 3's over here, 9's over here. So I'm going to tell you where I'm at on the clock just so you know, so they don't freak out, right? And then you do an internal assessment. If they consent to it, like nobody has to do it,
Yeah.
right? It's different than an OB-GYN exam. It's not using a tool. It's a finger assessment, and typically it's painless, right? So with that, you're going inside the vagina, and I'm palpating different muscles to
Okay.
see, again, tension, coordination, strength, length. So that's where you want someone who's like being your little detective, because at the end of the assessment, I'm going to tell you, hey, look, here's what I think is primarily driving or contributing to your symptoms, and here's what you should do to start.
All right.
I'll do that to palpate your different muscles and functioning and coordination. We'll screen you from some other things that can contribute, like prolapse, like I talked about before, just laxity. So that's typically how it is for a woman. Oh, and you can also assess a woman rectally too. That's going to be more for if they have more bowel related complaints. So with men,
Yeah.
they don't have a vagina, but
Yeah.
they have a rectum. So typically when you go through pelvic training for men, they teach you how to assess everybody rectally,
Okay.
which is different than when like urologist does it. Yeah, we're looking at the area. But I used to do that in the majority of men, and now I rarely do it because you really don't need to most of the time, unless they're coming to you for bowel specific complaints. Most of your front pelvic floor is right under your testicles. It's like your perineum,
Okay,
right?
yeah.
So your taint. So that you can all palpate
Right,
externally.
right.
You know what I mean?
Men always get it so much easier.
I know, right? But there are some men
Yeah.
who do who do need it. But that's what I'll see a lot of, like men coming in for urinary complaints.
Sure.
Went somewhere else. Yeah, they stuck a finger in my butt and treated me for 5 visits that way, and I didn't get better. And I'm like, well, your bum is here and your complaints are here. So
Yeah.
why aren't we looking where your complaints are? You know what I mean?
Makes sense, yeah.
But yeah, I always say, look, if you're coming in for testicle pain or urinary issues and they're only looking at your bum through your anus, like
Yeah.
find someone else.
Yeah, right.
Please.
Are you
Please.
even at a therapist's office?
Are you?
How dare you?
So yeah, so
I
that's
was at HEB. It's weird.
back room. But yeah, so So essentially it's the same for a man, but I don't, like most of the time I'm not doing, you will still get the symptom assessment. You'll still get the visual of like your pelvic floor. But with women, you can't like move anything out of the way. You kind of just look. For a man, what I'll say is, okay, I'm going to come in. I'm going to give you a hand towel. You're going to drape it over your genitals and just furniture out of the way, rest it up on your belly, move it to the side. Doesn't matter, right?
All right.
So just because I don't really need to see what your testicles look like. You
Sure,
know, if
sure,
you've
sure.
been
Unless they're
screened,
as big as melons.
then you'll see it, right?
When it's abnormal. Got
Right.
it. Okay.
Right. So say squeeze, relax, push out. We'll palpate externally. So like near your taint, on the sides, maybe kind of near your bum. But again, it's the same thing. Like if you have a ED, let's say, and you're younger, no medical, they've screened everything medical,
Right.
and I'm palpating on that muscle that in women surrounds the opening, but men is closed and right from your balls to your anus. Okay.
The Devil's Highway.
Yes, there you go.
That's what it's
There you
called.
go. If I touch that and you're like, oh, that kind of hurts.
Oh,
or
yeah,
like,
right.
oh, that feels like a sore muscle. Or like, that brings on my penis pain.
Yeah.
I'm not near your penis, right?
Right.
But I'm on the muscle that goes up in your penis, right? So I'll say, okay, symptoms, yes. Come off, no symptoms. Symptoms, come on. You know, like,
Sure.
so
Yeah.
I'm drawing the connection. And then for men, it gets a little bit different when we look kind of in your inguinal canal, just kind of externally palpating. And then we'll look at your abdomen because remember your belly attaches into your pelvic floor. So a lot of like penis pain or tip of the penis pain or testicle pain is actually abdominal dysfunction. So sometimes you'll be on someone's abdomen, you know, up on the left side. And you're like, you know, you'll be palpating way up here, and they're like, oh, I feel that right in the tip of my penis. That's my pain. That's my symptoms. And you're like, oh, okay,
Interesting.
got it, right? Like, but that's because when you think about how your muscles kind of form, they start in your abdomen and they go down, just like your testicles. They start up in your belly and they descend down
Gotcha,
through your
yeah.
inguinal
it's
canal.
All, it's all connected.
Yeah.
Okay.
Yeah. So men, again, minimal internal assessment for me, at least as a practitioner. And you really don't need it. Again, we'll do any type of functional assessment too, but like typically men aren't having leakage with, you know, jumping or something like that. It's more like, with prolonged sitting or when I'm working and driving and on the whatever truck or whatever around here, I'll get symptoms after sitting for a while. And so I'll say, okay, so in sitting, you're a little bit bent forward. So your spine is flexed a little bit. So I'll have them do repeated spinal movements, flexion based, and say, okay, what's your testicle pain at? All right, 5, great. Bend forward. Let's do 10 of those. And this is clothed, by the way.
Okay, I'm doing it right now. Okay.
It's
it.
clothed, but I'll say, okay, bend forward 10 times and then re-rate your symptoms. So if they come back and they're like, oh yeah, my pain is now a 7. Okay. So flexion based exercises increase your pain. So then what you would do is you would implement some sort of extension based exercise. Did it decrease it? And you're like, yeah, it's better. Great. So then, okay, you're sitting flexed for your work. So every break you get, stand up and do these extension-based exercises.
What about for like the kiddos? Like,
yes?
how does pelvic floor physical therapy help?
So typically what I see in kids or who I see is prolonged bedwetting, constipation, poop leakage, pee leakage, frequent peeing, strong urges to pee with lack of control. So when I assess a kid, it's very different than women and men. We're not palpating
Sure,
externally. We use the ultrasound a lot just to see how everything's moving. We'll look externally, but usually I'll be like, okay, well, you know, do you see these muscles here? This is your poop hole, and this is the muscle. So do you think it needs to squeeze or open when you
That's
know,
how you'd have to
poop?
talk to me. It's the
Right.
same thing.
And
Yeah,
some
I get
people it works great, right? But the kids, usually they're like, you know, they get it when you
Right.
talk, because every kid is like, oh yeah, my poop hole. Like they get that. You know what I mean?
Yeah, they're down.
So then what we do, we assess it using the ultrasound, and then I'll say like, hey, do you want to see what your poop hole looks like? They're like usually like, yeah, sure. So you just look at it like on their side. And a
Right.
lot of times you'll say, do you want to see it in a mirror? And they'll say, yeah, sure. And then they'll do this. They'll just stare at their face. They don't even care. You know what I mean?
Oh,
They
right.
see a mirror and they're like,
Yeah. Ooh, look at me.
I'm like, okay, do you see your hole moving? And they're like,
Yeah.
no.
Oh, it's not my poop hole. Your Instagram is very good, by the way.
Oh, yeah, nice. Thanks.
You got like Tuesday tips,
Try to do it.
right? You got
trying to-
new things on Thursdays.
Yeah.
A lot of stuff about poop on there,
Yep.
and like models, not like like in a fashion magazine, but like anatomical type of thing. So it's
Absolutely.
very cool. I read something that you put out on social media that said for every 35 pounds that you gain as a man, like you lose an inch of your eggplant
Your penis
downstairs.
length.
You're downstairs. What does that mean? Like, how does that work?
So
Where does it go?
just disappears. No. What happens is typically when you gain weight, you're going to gain it a little bit more around your abdomen. Okay.
Yeah, okay.
So it's putting pressure on your pelvis, and what you'll see is your penis length shortens and it'll actually retract inside your abdomen. Okay.
Okay.
So it doesn't disappear
Like
per
a turtle.
se.
Like a
Yes,
turtle.
exactly. Like a
Okay.
turtle head, right?
Going into a shell.
Exactly.
Going into a
exactly.
shell. Okay.
So when you do a Kegel for a man,
Yeah.
this is actually one way you can kind of cue someone to do a Kegel correctly. And it depends on for what purpose and whatever. But you can cue them like retract your penis or contract it. Because remember, your belly attaches into your pelvic floor, specifically the front. So
Okay.
where the shaft muscles are, okay, or the muscles that go up to mid shaft. So what happens is when you have increased weight, specifically around your abdomen, it kind of curls it in or it'll retract it
Okay.
in.
What about on the flip? Like, because I was sitting there going, like, what if I lost 350 pounds? You know what I mean?
So gaining weight, it's going to make your penis shorter just because it retracts in.
If you're trying to lose weight, just think.
You're gonna gain
35
inches.
pounds. Just make that goal. Every 35 pounds, you're on to something. Okay.
I don't know I don't think it grows like if you're at a normal weight and then you maybe if you have some fluff around the
Dang
abdomen,
it.
sure, why not?
Okay,
I don't know.
I was thinking about a Maro Gelato tonight, but I don't think so anymore.
It's not worth that
Not
one
worth
inch.
it. It's not worth it. Listen, is there anything happening with you or your practice or anything you'd like the city of Midland to know?
Sure. So I think just know that we're here
Mm-hmm.
for any pelvic related complaints. Like I said, most of our referrals come from providers in the area, but there's still people every day that reach out like, I didn't know you were here and da da da. And part of it is because, we practice within COM and we're in their physical therapy department, but like we only see pelvic candidates. I'm not treating your knee. I'm not treating your shoulder. Like you're coming to me for some sort of pelvic complaint. So just know that like kind of where we are. We have a free prenatal exercise class,
Nice.
aquatic exercise class that we host on Thursday. We're going to hopefully start offering a land-based exercise class for pregnant women as well. Again, we're just trying to really serve a need in Midland and Odessa, and we want to help people without having any sort of financial thing limit you from having a healthy pregnancy and
Right.
a healthy birth afterwards. So we're going to be doing a couple of like pop-up pelvic floor and core classes around town, maybe some at COM and some other facilities in the area. So that's still kind of in the works.
Be on the lookout.
Be on the lookout.
Yeah, let us know and we'll get it up on the website.
Yeah, if
too
you have an
and
event,
put
put
it
it on the
our-
website.
in our emails.
Yeah, and then we'll take virtual clients too as well. If people are like, yeah, I have this issue, but I want to go in person for whatever reason, or you're far away, or
Sure.
time commitment, or whatever, just reach out to our Instagram or our website, and we'll try to work
Nice.
with you on
Okay.
that.
All right, we'll see you on the next one. Bye. That's all you have to do because really, like, YouTube doesn't even care. Like, your retention will go like, once they even think you're going to wrap up, they're
Yeah.
going to go like,